Hello, I'm going to talk about HIPAA, which is the Health Insurance Portability and Accountability Act of 1996. I'm going to begin with a brief summary. Basically, they developed regulations to protect the privacy and security of certain health information. They created national standards for security of paper and electronic protected health information, electronic exchange, and the privacy and security of health information. So basically, overall, it's patient confidentiality. HIPAA applies to health plans, healthcare clearinghouse, and any healthcare provider who transmits health information in electronic form, and Medicare prescription drug card sponsors. Electronic protected health information includes all individually identifiable health information a covered entity creates, and I will discuss covered entities more later. Every covered entity must designate security personnel to develop and implement security policies and procedures. All workforce must be trained, and punishment must be implemented right away. Penalties range from $100 to $50,000 per violation. An annual maximum of $1.5 million is set. Jail time may range from 1 to 10 years when an employee knowingly violated HIPAA. Some common HIPAA violations include 1. The failure to adhere to the authorization expiration date. 2. Failure to immediately release information to patients, because patients have the right to receive access to their personal records immediately, and anyone who does not comply to that violates HIPAA. 3. Improper disposal of patient records. So basically, any patient record on paper needs to be shredded. 4. Missing patient signature. A HIPAA contract without the patient signature is completely invalid, so that would be a HIPAA violation as well. 5. Releasing the wrong patient's information, and it gets very specific down to 6. Telling friends and family about patients in hospitals, and 7. Discussing private information over the phone in a public place. There's one case from UCLA where a research cardiothoracic surgeon at the UCLA School of Medicine was fired, and after being fired, he illegally accessed the UCLA medical record system over 300 times, viewing health records of his immediate supervisor, co-workers, and several celebrities, including Arnold Schwarzenegger, Drew Barrymore, Leonardo DiCaprio, and Tom Hanks. He was sentenced to 4 months in jail and a $2,000 fine. As I said, I was going to get more into covered entities. Covered entities, as I said before, are healthcare clearinghouses, health plans, healthcare provider who transmit health information in electronic form, and Medicare prescription drug card sponsors. Some more specific examples include doctors, clinics, psychologists, dentists, chiropractors, nursing homes, pharmacies, surgeons, radiologists, and so on. And it also includes health insurance companies, HMOs, company health programs, and government health programs. Basically, their responsibilities are to comply with HIPAA laws, and they must provide individuals with certain rights with respect to their health information. So they must give patients the HIPAA form for them to sign, and they must make them aware of how to access their health information online. Business associates are slightly different from covered entities. They're more behind-the-scene workers that may come into contact with personal health records. So they may include medical billing services, IT service providers, practice management, marketing companies, accountants, and more. And their responsibilities are similar to covered entities, and they basically just help covered entities carry out its healthcare activities and functions. So they also comply with the HIPAA laws and maintaining privacy. Finally, I was going to talk about businesses. So businesses have to give specific training on HIPAA. Some include classes, and others include short 20-minute videos that go more into detail on specific violations and how to maintain the correct actions in the hospital or around patients and health records. In fact, I am going to school to become a physical therapist, and I am currently observing at the Sioux Center Hospital. And the first day I came in, they had me sit down in a room and watch a video over HIPAA. And they showed things as simple as workers hiding their computers so people and other patients and whatnot can't look over the counter and see patient records up on computers. Or it also talked about people talking in public areas on the phone, or workers talking very loud at the desk about specific health records and saying names and whatnot. So they provide training for pretty much anyone who's going to come into close contact with patients. Additionally, they must properly and accurately keep records. Proper storage of records is really important for security, so they're all in the right place, and it's difficult for outside sources to access those records. And finally, as I said before, a security personnel must be selected and trained to carry out and implement policies and procedures to help comply with HIPAA. Lots of times this is the Human Resources Department that works specifically with that, and that's who set me up with the video at Sioux Center Hospital. So I found that very interesting, and I believe that will be very helpful for me in the future since I want to become a physical therapist and own my own business someday. So I will have to train other people and hire people to train other people, and I will need to be able to comply with HIPAA laws myself. Thank you.